hydrostatic pressure and the other is osmotic pressure, or we call it oncotic pressure, either of the two. So yung pag maririnig yung hydrostatic pressure, this is the pressure that pushes the fluid out of the vessel. Okay? So for example, capillary pressure or capillary hydrostatic pressure, it will push the fluid outside of the capillary into the interstitium. Okay? Pag sinabi nating interstitial fluid pressure or interstitial hydrostatic pressure, ito naman yung pressure that will push the fluid back into the capillary. So kailangan huwag kayong mako-confuse. Meron tayong tinatawag na oncotic pressure or osmotic pressure. This is the pressure that holds the fluid inside the vessel or moves the fluid into the vessel. For example, plasma colloid osmotic pressure, this is the pressure that keeps the fluid inside the capillary or allows the flow of fluid from the interstitial space into the capillary. And then meron din tayong tinatawag na interstitial colloid osmotic pressure. Meaning to say, this is the pressure that pushes the fluid from the capillary into the interstitium. Or it is the pressure that absorbs fluid from the capillary into the interstitium. Either way, as pag sinabi natin tumaas ang colloid osmotic pressure, meaning to say, more fluid will go into the interstitial space. So huwag kayong maguguluhan. Si hydrostatic pressure, away, palabas ng vessel. Si oncotic or osmotic pressure is towards the vessel. Naintindihan niyo yon? Okay ba? Narinig niyo?
Yes, Doc.
Yes.
May nag-message.
Yes, Doc.
All right, talino. So yun lang yung sinabi ko. Capillary pressure, outward. Interstitial fluid pressure, inwards. And then, meaning papuntang capillary, ha? Yung ibig sabihin ng inward. From the interstitial space into the capillary. And then, but if the interstitial fluid pressure is positive, or it's positive, but it will be when the force of the fluid is inward through the capillary, if it's if the interstitial space is the fluid pressure in the interstitial space is negative, then that's the time na papasok siya. Pero I mean, the fluid will be from capillary into the interstitial space. Pero pag positive siya, it will be from the interstitial space into the capillary. Pero hydrostatic pressure pa rin, again, this is the one that pushes out of the space or of the vessel. So capillary plasma colloid osmotic pressure is the one that causes the fluid to stay in the capillary. While interstitial fluid colloid osmotic pressure, this is the one that causes osmosis of fluid outward from the capillary into the interstitial. All right. So, yung pag if the tissue is encased inside a tightly covering, most of the time it will be negative. Let's say the intrapleural space, negative siya. Or joint synovial space is negative siya. So, pwede siyang maging positive, pero hindi gaano kataas yung pressure. Okay? You don't need to memorize this number. This will not come up in the exam. Nakakaloka kung i-memorize nyo. Epidural, negative 4 to 6. Joint synovial, negative 4. Hindi yan lalabas, I think, sa board exam. Kaya huwag kayong mag-memorize. Okay? And we are just trying to show you that interstitial fluid pressures in tightly encased tissues may have more negative or lower pressure. Okay. So yung plasma colloid osmotic pressure, again, this is the pressure that holds the fluid inside the vessel or moves the fluid from outside papasok into the vessel. So the oncotic pressure in the capillary or in the vessel or the plasma itself is about 28 millimeters mercury. So 19 of that is because of large proteins like albumin, globulin, and merong 19 millimeters mercury. While 9 millimeters mercury is yung because of what we call as Donan effect. Ito yung all other molecules have this osmotic capability. Parang it will draw fluid inside the vessel. So yun yung dominant effect. But sodium, potassium, and other cations have a smaller effect lang in terms of the plasma colloid osmotic pressure. Yung pinaka-large bulk ng pressure is made up of large protein. Okay? So the interstitial fluid oncotic pressure for this concentration is only 8 millimeters mercury, whereas sa loob ng capillary or sa loob ng vessel, sa loob ng arteriole is 28 millimeters mercury. So kung titingnan nyo, saan papunta yung fluid? Is it from capillary into the interstitium or interstitium to the capillary? So kung colloid osmotic pressure lang yung pag-uusapan natin, hindi kasama sa hydrostatic pressure, the flow of fluid sana is from the interstitial space into the vessel. Kung colloid osmotic lang. Because mas mataas ang osmotic pressure inside the capillaries than in the interstitial space. 28 ang nasa plasma, while 8 ang nasa interstitial fluid, colloid osmotic pressure. But there are other pressures, yung hydrostatic pressure. So the average capillary pressure at the arterial end is 15 to 25 millimeters mercury, greater than the venous end. So yung arterial end is, let's say, yung arterioles is about 30 to 40. So papunta sa capillaries, 15 to 25 na yan. And then papunta sa vein, less than 20, mga 10 to 15 na siya. Kaya the flow of blood will always be from capillary, from arterioles to capillary to veins. So ganun ang flow niya because of the hydrostatic pressure na mas mataas the capillary. The arterial end than the capillary end. So paano na measure yung pressure inside the arteriole? So gumagamit sila ng micropipette and then mini-measure nila. Nakakaloka yung mga trabaho ng mga scientists na talagang mag-measure sila ang vessel is, let's say, 5 to 10 nanometer. Sobrang lilit, and they have this micropipette that is able to measure the pressure. So buti na lang na-measure na nila kasi kung tayo pang mag-measure yan, maluloka tayo. No? So na-measure na nila ang pressure. Titingnan na lang natin ngayon yung kabuuan, all the pressures pushing and pulling of fluid in the capillary, kung alin ba ang net, yung net outward force. Okay? Kung inward ba or outward. Meaning pag outward, mas marami yung forces pushing the fluid out. Pag inward naman, there are more forces pushing the fluid inside. So, ito yung mga forces that tends to move the fluid outward, meaning from capillary into the interstitial space. One is the arterial and capillary pressure of 30 millimeters mercury. Ito yung hydrostatic pressure on the arterioles or arterial end ng capillary, 30 millimeters mercury. Then yung interstitial fluid pressure, since negative siya, so it will draw water towards the interstitial space. So that's an additional force moving fluid from capillary into the interstitial space, which is 3 millimeters mercury. And we have also interstitial fluid, colloid osmotic pressure. Again, this is a pressure that holds the fluid inside the interstitial space or draws water from the capillary into the interstitial space. So kung i-add mo lahat, 41 millimeters mercury yung outward force. Meron ka ring fluid that pushes into the capillaries. And that includes the plasma colloid osmotic pressure. This is the pressure that holds the water inside the capillary, which is 28 millimeters mercury. Whereas, siya lang siya. So 28 millimeters mercury. So you will get the difference. That is 30 millimeters mercury. So at the arterial end of the capillary, there is an outward force by 30 millimeters mercury, meaning water or fluid will flow from the capillary into the interstitial space. Okay? Hindi lalabas to ha. Naka-red lang siya, pero I don't like numbers. Parang feeling ko, after how many years, di mo na rin maalala yan. Mas gusto ko yung maintindihan nyo yung concept behind the pressure. I would rather ask you if the colloid osmotic pressure of the capillary or inside the capillary, is it moving the fluid into the capillary or outside of the capillary? Something like that. I would rather have you memorize that. Yung concept, hindi yung number. So sa capillary mismo, 0.3 lang. So kanina arterial end, nandito na tayo sa capillary level, 0.3 lang. So kahit 0.3 millimeters mercury, that is still enough pressure to keep the fluid from the capillary into the interstitial space. On the venous end, 7 millimeters mercury yung net inward force, meaning fluid will move from the interstitial space into the vein. Kaya marireceive ni vein yung fluid and other electrolytes into the vein. Otherwise, pag tumaas ang pressure in the vein, ito yung sinasabi kong it will cause edema because the interstitial space, I mean, the flow of fluid will not go from the interstitial space into the vein, and so there will be a lot of fluid in the interstitial space, which is edema. Okay. So lymphatic system is important because it represents an accessory route. So for example, there are a lot of fluid in the interstitial space na somehow hindi makapasok sa vein. It will be the function of the lymphatic system to move or to bring back that amount of fluid into the system, into the venous system. So it will be collected through the thoracic duct or meron ka pang duct sa right. I forgot ano, duct sa right. Di ba sa left thoracic duct? Meron ding duct sa right. It will drain into the right subclavian vein before going to into the superior vena cava. So ganun din si thoracic duct on the left. It will drain into the left subclavian vein. So all this water will now be brought back into the circulatory system. Okay? So, yung lymphatic system then, another function of that is, di ba meron kang proteins like albumin that are supposed to be inside the vessel in the capillaries kasi sila yung nag-prevent ng too much fluid going into the interstitial space. So, some of this albumin can penetrate or makaka-exit sila into the interstitial space. And this albumin cannot go back into the capillary because yung gradient niya mas maraming albumin doon sa capillary kaya hindi siya makakabalik. So the only way for an albumin to go back into the circulatory system is through this lymphatic. Now, if there is a problem in the lymphatic, this albumin, these proteins, it will stay in the interstitial space, and so the interstitial colloid osmotic pressure will rise, and it will draw more water from the capillary into the interstitial space, and it will augment edema. So this is one of the mechanism paano ka nagkakaroon ng edema. So ganyan yung mga lalabas sa exam. What causes edema? So mag-iisip ka, is it increase or decrease of capillary hydrostatic pressure, or increase or decrease of interstitial oncotic pressure, mga ganun. So ngayon pa lang, iisipin nyo na siya para pagdating sa exam, hindi na kayo may stroke. Okay? So aside from removing too much fluid in the interstitial space, aside from the function of the lymphatic system, the second function is to remove the albumin in the interstitial space. Marami pang function yung lymphatic system. One of which includes it creates that negative pressure kung saan yung cell will be united together. Alam naman natin na cells don't separate because of may mga collagen, may mga kung anong structures yan, but it's also because of the negative effect brought about by this lymphatic system. So that without the function of the lymphatic system, without this negative pressure in the interstitial space, a person will die within 24 hours. And I see this clinically. Yung mga ICU patients ko, dahil comatose na sila, bedridden for, let's say, more than 2 weeks, eventually namamaga yung extremities, mataas yung mortality. Kaya, importante din si lymphatic system. Because the lymphatic system, since it draws fluid out from the interstitial space, it keeps the pressure inside the interstitial space to be negative. And you want the interstitial space to be negative. Okay? So, 100 ml per hour ang lymph flow in the thoracic duct. And that's about 20 ml into the circulation each hour. Okay? Making a total estimated lymph flow of 120 ml per hour or 2 to 3 liters per day. Yun lang naman yung rate of lymph flow. So this is determined by the product of interstitial fluid pressure times the activity of lymphatic pump. So yung interstitial fluid pressure, this is the pressure that moves the fluid either into the capillary or the fluid, the pressure that moves the fluid into the lymphatic system. Yan yung function ng interstitial fluid pressure. So hydrostatic pressure siya, so away, pa-away sa interstitial space. Okay? Merong other factor to keep the lymph flow, to keep the lymph flowing, and that is through an active lymphatic pump. Ano naman yun? Yung lymphatic system has also smooth muscles that it contracts. So, pwede siyang vasoconstrict para mag-flow pataas yung lymphatic fluid. Meron din valves ang lymphatic vessel na para pag umakyat na siya sa another point, nandun na siya kasi mag-close yung valve. So, pataas lang siya ng pataas. It will just move towards the thoracic duct. Okay? So these are the factors that keeps the pressure, the effect of interstitial fluid pressure on the lymph flow. So these are the factors that increases the interstitial fluid pressure, which increases the lymph flow. So elevated capillary hydrostatic pressure. Ito yung pressure wherein water will move from the capillary into the interstitial space. So if this will increase, the capillary hydrostatic pressure, there will be a lot of fluid moving into the going into the interstitial space. So somehow the lymphatic flow will also increase. Decrease plasma colloid osmotic pressure. So pag bumaba yung plasma colloid osmotic pressure, walang nagkikip ng fluid inside the capillary. So fluid will now go into the interstitial space. So increase interstitial fluid colloid osmotic pressure. Ito naman yung will draw water into the interstitial space or increase permeability of capillaries. Ganun din siya. So you have to memorize all these factors because this will increase the lymphatic flow. At the same time, ito din yung nakaka-cause ng edema because too much of this will cause edema. So given na yan, no? Ito yung mga factors na lalabas. So papalitan lang dyan ng isa. Kung ikaw yung teacher, which of the following will increase lymph flow except mga ganung drama. So, yung elevated capillary hydrostatic pressure gagawing decrease. So, ganun lang ang mga exam. Kaya, kailangan nyo itong i-memorize. But, it would be better if you would understand the concept. Bakit siya palabas? Bakit siya papasok? So, dalawa lang naman yan. You have hydrostatic pressure, which will push fluid outward of the vessel, and you have oncotic pressure, which will move or maintain or contain fluid inside the vessel. So, pagpapalit-palit lang ng pangalan, capillary oncotic pressure inside the capillary. Capillary hydrostatic pressure or plasma hydrostatic pressure, palabas ng capillary. So, ganun din sa interstitial hydrostatic pressure, it will be outward from the interstitial space, either into the capillary or into the lymphatic system. Naintindihan niyo yun? Okay ba? Okay pa bang signal?
Yes.
Hello?
Yes, Doc.
Yes, Doc.
I hope naintindihan nyo ito ha. Importante ito ha. Lalabas sa exam, mga one question.
Nire-digest pa naman information, Doc.
Ay, digest mo ng maayos, nakakaloka. Pero kung mag-memorize ngayon, i-memorize mo na to, okay na yon. Pero, mas maganda kung maintindihan mo. Okay? So, So ito yung sinasabi kong merong kang valve kasi yung cell meron siyang end diyan na nag-join parang it overlap. Parang it creates like a valve system. So this two will close, pagpasok ng dugo, this two will close para hindi na bumalik uli yung dugo. Okay? So yung kanina, this is the pressure. We're talking about pressure that increases lymph flow. This one naman is the pumping. Diba? The lymph flow is based on the pressure as well as pump. So yung pump is due to contraction of surrounding skeletal muscles. If your muscles contract, it will squeeze the lymphatic vessels, which will improve the flow. Or when you move, when you patient exercise or tumayo or any movement, it will also improve the lymphatic flow. Even the pulsations of the arteries, it somehow pushes also the fluid kasi magkakabilang naman si lymphatic system at saka si arteries. And finally, compression of the tissues by objects outside the body. Okay? Kahit ano mang yan, na-compress ka ng jowa mo, pinumpress yung kamay mo, so it will somehow improve the lymphatic flow. Okay? So compression. All right. So if there is the lymphatic system has plays a central role in controlling the concentration of protein. Sinabi ko na to. You want not too much protein in the interstitial space because if the proteins will increase in the interstitial space, if the oncotic pressure in the interstitial space will increase, and it will draw a lot of fluid from the capillary into the interstitial space, and it might cause edema. Or the volume of interstitial fluid. So, yung lymphatic system is a drainage in the interstitial space. Kasi pag there is too much fluid in the interstitial space, the lymphatic system should work para hindi marami ang nasa interstitial space. Okay? So, interstitial fluid pressure. So, by removing fluid in the interstitial space, you also decrease the interstitial fluid pressure. So, when the tissues lose because of this effect of the lymphatic system removing fluid in the interstitial space, nagiging negative yung pressure in the interstitial space. So it creates a vacuum. Okay? So when you lose this negative pressure, the fluid accumulates in the space and it will cause edema. So kung makakakita ka na nag-edema yung pasyente, either pitting or non-pitting, pag sinabi natin pitting, when you press that, nakalupok yung kamay mo. Pag non-pitting, pag press mo, lumulupok. Pero pag release mo, walang indention. Hindi nakikita yung indention ng thumb or finger mo. So it's a non-pitting edema. Either of the two, it's still edema, meaning there is too much fluid in the interstitial space. Kasi dapat walang fluid sa interstitial space. So there must be a problem in the lymphatic system. Either there has been an increase in the oncotic pressure in the interstitial space, or there is a decrease in the hydrostatic pressure. For example, an increase in the hydrostatic pressure, increase of hydrostatic pressure inside the capillary, or a decrease in oncotic pressure inside the capillaries. Tama? Yes. Or there is obstruction of the lymphatic system, that's one. Or the patient is not moving at all, kaya hindi natutulungan yung pump. So these are the factors that will cause edema. You have to analyze this information. Okay? Yay! Isang chapter pa lang yung